Standing Committee to order on May 20th, 2026 at 5 p.m. Roll call, please.
Schoonover.
Here.
Kramer.
Here.
Engel.
Here.
Welty.
Here.
Thompson.
Here.
Perry.
Here.
Frank.
Here.
Severson.
Present.
Cooey.
Here.
We have 9 for a quorum, sir.
Do we have verification of open meetings law compliance?
It's properly used.
And do we have approval of agenda?
You have to remove item number 9.
If we remove item number 9, it's the amendment. So do I have a motion to accept the agenda? Supervisor Frank, second by Supervisor Schoonover. All in favor, please say aye.
Aye.
Any opposed? Approval of the minutes from last time. Any concerns, questions, comments, or thoughts?
Mr. Chair,
Yes, sir.
in the minutes of the previous meeting, after each item recommended to the county board by this committee, stated that the recommendation is for final approval. To me, this infers that a rubber stamp approval is forthcoming from the entire county board. Nothing could be further from the truth. In my opinion, in each instance, the minute should read for final consideration by the county board, with the full county board. And my motion is to change the previous minutes to read for that final consideration and to use this terminology in future meetings and minutes.
Is there a second?
I'll second.
Discussion. Going to move toward full transparency. Nice job, Supervisor Perry. Others? Hearing none, all in favor signify by saying aye.
Aye.
All opposed, motion carries. Motion, minutes are approved with that clarification. The acclamation. And public comment, we have 4 so far. And we'll go in the order they came in. And Judy Sharman, you have 3 minutes, please.
This isn't so much of a statement, it's just a couple questions. And I would like to know if the county board has met with every township at one of their meetings, so everybody knew exactly what we were proposing. That's one of the questions. And then I want to know why we need a backup administrator. How many jobs does he need? He's head of the highway department, emergency management, and now the assistant administrator. Just a thought.
Thank you, Judy. And next is Rachel Ward.
This meeting is being transmitted.
My name is Rachel Ward. I'm an advanced emergency medical technician for Richland County Ambulance. I'm here to advocate for my patients and beg for my job. Over the last few months, a lot of discussion has taken place regarding how you're going to fund the ambulance service. That was the issue, or so we thought. It was repeatedly stated to us that we weren't the problem. It wasn't that the county wanted to shut the ambulance service down. It was just a matter of funding. Well, the county board voted last week to fund an ambulance. So that means our jobs are safe, right? On the agenda tonight is discussion and possible action of proposals received from ambulance services. You received several proposals from different private EMS services in Wisconsin, as well as a proposal from the already existing ambulance service. While we are not the lowest possible bidder, we came in second place. The lowest bid you received is from a company who serves a large part of Vernon, Monroe, and La Crosse counties. When I spoke to the county board, I told them the people of Richland County don't deserve to wait an hour for an ambulance. And I repeat that to you again. The people of Richland County don't deserve to wait an hour for an ambulance. They don't deserve to have their emergency medical care handled by the lowest bidder, who has demonstrated they can't meet the demands of a 911 system. Sparta waiting for an ambulance from Fort McCoy, Baroba waiting for an ambulance from Lafarge of Viola. Is that really what you want for the people of Richland County? Any one of us could experience a medical emergency at any moment. This doesn't just affect the taxpayer, it affects each and every person in this room. The chance of surviving a cardiac arrest drops 7 to 10% for every minute without intervention. It takes less than 3 minutes to bleed to death. The human brain loses approximately 1.9 million neurons for each minute an ischemic stroke goes untreated. In EMS, we are not often given the gift of time. We have to make critical decisions as quickly as possible and deliver the patient to a higher level of care as soon as we can. Do you really think bringing in a private service who is already making the residents of Sparta, Viroqua, and La Crosse wait an hour before showing up to provide care is truly what's best for Richland County? Do you really think that's what your constituents deserve? Let's say this big private company can't respond to a 911 call in Richland Center. Who's coming? Hopefully Muscadet can get a crew together, but they might not be able to. So who's next? Lone Rock? Hopefully they can get a crew together. But wait, they can't either. So now who do we pay? Spring Green? Hillsborough? Reedstown? Think about the time it takes for an ambulance to get here from any of those places. How many brain neurons is that? How much blood volume is that? How much heart tissue is that? The same private service stated in their RFP that they plan to come with their own employees and not retain any of the current staff. So they're just going to take their already stretched too thin staff and make them cover Richland County too, and we're just left jobless. Not to mention, in the comparable sheet, there's nothing listed for their yearly increases, unlike the other proposals. Does this mean their cost is going to change yearly? I don't want to be unemployed. I'm a single mother to a 10-year-old boy with autism. I've spent my entire life in public service. I don't know how to do anything else, and I don't want to do anything else. I came to Richland County because I'm from here. I grew up just over the bridge in Muscadet. I know these roads because I spent my teenage years learning how to drive on them. I'm not alone in this. Many of our staff are born and raised Richland County residents. Is the board seriously considering cutting local jobs in favor of a company from an hour and a half away that already can't staff what they currently have? It would be one thing if we were the problem, but we aren't the problem, we were told. Funding was the problem. Well, funding has been fixed. So where's the problem? Why is this even up for discussion unless the goal the entire time was to shut down Richland County EMS? As you work your way through tonight's agenda, I want you to think about your loved ones, your parents, your children, your best friend. If they experience a medical emergency, who do you want showing up? Your proven local ambulance service or a big company from La Crosse that can't cover their own calls and relies on surrounding volunteer services to pick up
Rachel,
their
I'm gonna
stuff?
have to ask you for 5 more seconds.
I'm done. This is about more than just cost. It's about people's lives. I urge you to do what's best for Richland County. Keep your existing ambulance service in place. Thank you.
Rachel, thank you for your words and your passion. It's hard to keep in 3 minutes. Bruce Ressler.
Good afternoon. I'm Bruce Raisler, and I happen to be the Chief Executive Officer of the Richland Hospital and Clinics. I want to state at the outset that I'm here as a private citizen. The hospital board has not even discussed taking a position on the issue of the ambulance service. But it's something I'm trying to follow with interest and keep up to speed. I'm not a student of the circumstances that have led us to this point, but obviously it has an impact on all of us. I guess I'm here to say I'm in favor of trying to find a way to maintain the status quo and the ambulance service. It seems like it has served us well over the years, and just like your local hospital is independent, that doesn't mean that we don't have expertise. And when we don't have expertise in the hospital, technical expertise, we find a way to get that expertise. Talking to our peers, other hospitals, talking to agencies that could consult with us and provide whatever information is necessary. We don't go out and sell the hospital because we don't know how to best bill for our services, for example, or that type of thing. So as a citizen, I just, observe that having local control of businesses and community services is best if we can find a pathway to maintain that. We're all familiar with examples of when services were no longer locally managed or owned, and how that had a detrimental effect on the quality of service. So hopefully there's a pathway that all these public objectives can be fulfilled.
Thank you.
Thank you.
Sharon.
Thank you. A little history. In September of last year, the ambulance director was terminated and Administrator Clements stated she would step in. However, in that day or so, Barb Scott was hired as an interim director and the county stated that they would be advertising for a director. Shortly after, Administrator Clements stated that the county would be out of the ambulance business, so there was no need to hire a director. Up until September 2025, a memorandum of agreement was signed for a 2-year period by the city, townships, and villages. The current MOA expired December 31st, 2025. The county stated at this time that the county no longer wanted the present MOA and offered a one-year contract which involved more expenses to all who agreed. This was not received well, and several municipalities asked for the county's recalculation, and the figures were incorrect in determining the amount which entity would agree to pay. After a numerous calculation and dollar amount questioned and changed, it was agreed that the county's 2027 one-year contract would be signed, giving the city and municipalities 1 year to figure out a different solution. Not all municipalities signed the new MOA. It was stated that those not signing the contract would need to find service of their own. During this time, the Joint Ambulance Committee was disbanded and a new unofficial ambulance committee was appointed. In January, a resolution was made to have the ambulance facility feasibility study completed at a cost of $35,000. On March 24th, the unofficial ambulance committee met. A unanimous decision with verbal agreement was made that there be a countywide service which taxes the entire county outside the levy limit and asked for further information. As you know, the resolution to exceed the county levy limits was passed. In short and unofficially, this brings us here tonight. Discussion and possible action and review proposals received for the provision of an ambulance service. In my opinion, due to time running out for everyone's budget and not jumping into a decision that we cannot reverse, I would suggest that you strongly agree with the steps outlined in the March 30th letter to the Board of Supervisors, which was signed and supported by representatives from 10 townships, 2 villages, City of Richland Center Fire Chief, and Richland County Ambulance Association. As I quote in part, step 1, formally establish countywide EMS. As part of this step, in addition to continuing to operate the county ambulance service as a county department, the county should execute service agreements with the municipalities already receiving EMS service to formalize those relationships under the countywide framework and structure those agreements to allow the county, requiring the county to expand its existing operations. Also, the letter states, we stand unified behind this recommendation and are committed to working with the board and the county administrator to make it a reality. End of quote. Please read the letter in its entirety. If you don't have a copy, I can get you one, because it also addresses the third-party service. Please don't weigh lives against. Please don't weigh lives against dollars. Thank you.
Thank you. Is there anybody else for public comment, either present in the room or online? Hearing none, that completes item number 6.
Hello,
No, you can't do that.
hello, I'm online. Could I speak?
Yes, Bernadette, please. You have
Yes.
3 minutes.
Yes, okay. My name is Bernadette Zach, and I've been visiting Richland County since my childhood and have finally had the opportunity to retire in Richland County last year. My grandson was born at Richland Center Hospital, and we have a deep connection to this area. He was born with intestinal failure and requires extensive medical support like IV nutrition to stay alive. We have been fortunate that he has not experienced a true medical emergency here when he's visiting us, but that possibility is something we are always aware of. He lives in La Crosse right now, but when he does visit us, if there was a medical emergency, we want to know that the public service would be dispatched quickly enough to take care of it. I'm deeply concerned that Gunderson Ambulance or another private service that took over call times would the call times would increase and Cleo's life would be literally put in danger. We have seen how call times have increased for Sparta community with Gunderson Ambulance taking over the local service. As a new member of this community and a member who plans to live out the rest of my life here, I urge you to vote to keep the service public. If you decide to go private for my grandson's safety and well-being, we would have to reconsider whether or not he could come to visit us in Richland County, which would make us very sad. Thank you.
Are there any other comments in the room or online? We've completed agenda item number 6. We'll move on to number 7, which is the report of the county administrator.
I do not have a lot. Jeffrey Harris will be sworn in as the county clerk on June 5th, and his first day in office will be June 8th. And then we are starting to begin union negotiations for the ambulance service to develop a contract. County is not able to retain John Anderson as a county attorney, so we will be working with Andy Phillips to be the attorney on record for union negotiations. So that was confirmed today. And so between Mr. Phillips and myself, we will be getting everything together to have that first meeting and start the negotiations. And that is what I have.
Any questions or thoughts or?
What happened with John?
There is a conflict. His firm represents another entity that provides ambulance services, and he didn't get the waiver signed by them. We were willing to sign it, the other entity is not.
Any other thoughts or questions? Hearing none, we will move on to item number 8, discussion and possible action review of proposals received for provision of ambulance services. So I'll turn this over to the county administrator for both introductions of each of the presenters.
All right, so we will start today with Barbara Scott, who is the interim service director currently for our service. And I will be listing them in the order that the proposals were received.
Thank you. As most of you know, I am the interim director for Richland County. I have placed our proposal, and I have a few things with the comparison sheet that, as I looked, it's in your packets on page 92. Yep, that one. That kind of, I just had some things that I needed to point out to you. We currently receive a significant amount of funds from the PSAP grants. If we make this change, I am not 100%, but I think that those would affect our PSAP grant funds that we receive. The reason is we still have to provide EMT dispatching because we do dispatch for Lone Rock, for Casanova, and we take calls from Kickapoo and also from Muscadet and Blue River. Those have to be EMD dispatched, and I am not certain that the proposals from the other providers are including EMD dispatching for outside services than the one they'd be providing service to.
Just want to make a note that it's Richland County.
Yes.
Not Richland County EMS.
No, this is the PSAP.
It's Richland County.
Right, this is your
It says
PSAP, which is your dispatch center. This is not the ambulance I'm speaking about. So outside of that, it may affect those funds. And I don't know who's going to be doing the dispatching for those outside services. I don't know if that's been addressed. But that should definitely be a question that's addressed going forward, because you do have citizens that are not served by the areas suggested, and how are we going to dispatch for them? That's really important. Secondly, it speaks about a training officer. Every service in the state of Wisconsin is required to have a training officer. You cannot have a service if you don't. We do have one currently, and it is myself. We have a training program. And so when I read that there was no training officer on this comparison graph for Richland County EMS, I was a little confused because we couldn't exist as a service if we didn't have it.
If I could interrupt, it says dedicated training officer, so that is their full-time job to be the training officer.
Okay. And then I know that the training officer was suggested for other services to be available. I'm not certain that they're receptive to that. I don't know if we've had that discussion. The proposal also doesn't reflect, last month, we had 3 ambulances out on calls all at the same time on 3 different occasions. We provided that with no hiccups. My staff responded to this. Your proposals from your other services say 1.5. What happens when you need 3? It is happening. And it's happening frequently. When you have local people, even if they're not on call, when they hear that call go out, we all get notification. We're close and we respond. The 500,000, I had a question on that, but is charged to the county. It's equal throughout all of those. But are we charging that dispatch fee to all the other services as well, to the Lone Rocks, to the Kazas? I'm not suggesting we increase their costs, but are we charging that to them as well as this? And that would be for any entity to hit. There's a $500,000 fee in this comparison sheet, and I just don't understand it, I guess. Innovation grant, I'd like to address that. Last month, might not have been, it may have been earlier this month, Dana was here, and Dana said twice in that meeting, the innovation grant may be available to us as we have changed our staffing model from Richland County to countywide EMS. So I do believe that the innovation grant is available to all of us. Those are some of the comparable things that I think are really important for us to point out, for you to consider. I know that it was suggested in the plan from the county administrator and the finance director that there be $1 million set aside for 2 new ambulances. Having been on the ambulance for 30 years, that's not in the best interest of the county. When we fell behind with squad cars, we did not replace the entire fleet at once. We started replacing slowly so that now the county is on a rotation that is manageable for the county to do that. If you replace 2 ambulances immediately, you're not going to get onto that good rotation. That's not a good idea. I also recommend that we purchase a lesser expensive remounted ambulance that will save the county significant funds. I have found several that are between $185,000 and $250,000. And I feel strongly that those will support us and help us to get back on the rotation. We fell off the rotation, quite frankly, in 2016. Has nothing to do with most of you here. Most of you weren't on the board. I was not in this position. Trish was not in her position. This cycling happened because budgets were tight and we thought we could push it off. But the problem is the county did that with a lot of things. And I get it. There's only so much tax dollars. But you need to put us back on a rotation, just like we did with squad cars, with plow trucks, so that we're not found back in this situation in 5 years because we replaced 2 ambulances this year. It's just, that's not a good rotation to be on. The other thing that I would like to suggest is that I am certain that there were funds when I looked at the budget that can be shifted. And I did send that email, and I think that ours is a very viable request. But if you have questions about that, please come to me. I am happy to answer any of them. I've been in the position for a year. I've gotten comfortable. I found additional funding streams. And I think that those are all important things to know that we weren't utilizing before. Is there any questions for me?
Supervisor, just in terms of process, here's what my thought is that we hear each presentation and then we have a summary presentation by our staff. And then we'll open up for questions after that, just to keep things fluid.
I have a question regarding this comparison document that was added late to our packet. Is that going to be reviewed and discussed at some point in time? Because it's being referred to, and I'm not sure how to read this.
That's the one that I asked to explain. Yeah. Yep, so that'll be part of the presentation prior to questions. Okay. So thank you, Barb.
Thank you.
We'll turn it back to county administrator.
All right, next presentation will be from Gunderson. We have Tom Tornstrom and Walt here, and I will share share PowerPoint.
Well, good evening and thank you for having us here. We appreciate the opportunity to respond to this RFP, and it's a little difficult to be in the room and hearing us be vilified, but you know what, it's okay. But I hope our presentation kind of takes away from some of that. We've been operating ambulance services collectively as Amplified Health System since 1968. So it's something where we have the experience, we have the know-how. I do have just a short presentation. We'll cruise through here pretty quickly. Next slide, please. So overall, our two ground ambulance services cover about 200,000 population. Certainly the city of La Crosse and immediate areas, and then many rural areas such as Richland Center. We have the ambulance service that's responding to this RFP is Gunderson Health System Ambulance, and that is Walt is the manager of that company. That company provides service in West Union, Iowa, Prairie du Chien, Wisconsin, and now Sparta, with interfacility ambulance or transfer ambulance bases in Richland Center here in town, as well as Toma. That company's been in business since 2011, and it is a nonprofit. We're not really arriving here. This is something that we already have a presence in Richland Center. This is just essentially adding another 1.5 ambulances. There was a question earlier about responding with 3 ambulances. We do have an interfacility ambulance that will stay here, that will be part of that collective ambulance group. 60-ish% of the time that ambulance is in station. So what that means is we would have one 24/7 staffed 911 ambulance. We would have 60% of the time a backup interfacility ambulance, and then we'd have a half-time third ambulance as well. So I think you'll feel we can answer that question about the consecutive or the concurrent calls.
And that half is half staff, so that's 12 hours out of 24 hours, not one person on the ambulance. I think there was some confusion with that with 1.5 ambulances. So that's a 24 and then a 12-hour plus the one that's already here.
Next slide, please. So what we would commit to Richland County and to the areas that are participating is contract term of up to 5 years. We would upgrade to paramedic level, and that's a big deal. That's expensive. That's costly, but more than that right now is shortages of paramedics. We heard some discussion about 1-hour response times. Yes, on occasion that has happened. However, there's a reason we're here today as well. But the challenge is paramedics. EMTs, there's no shortage in our world. We have close to 80 on the waiting list right now for EMT level. It's the paramedics challenges. However, we feel confident that by startup, by January, we would be staffed up and ready to run full ALS, full advanced life support paramedic. Again, we are in town. We would stay in town and be very open to consider leasing the current location if it were to come to that. We would provide full EMD, emergency medical dispatch, to the entire county free of charge. That's just something we as Amplified Health do. Currently, we have 6 counties and Fort McCoy where we provide the EMD service, again, at no charge. And my understanding on the PSAP grant is as long as it's either provided by the county or through a contract, that qualifies. Medical direction. We have a very active and involved medical director. In fact, he was in this room a few months ago to present with us, just an early meeting. He is out of town, otherwise he would have been here today as well. But we would be a pleasure to provide medical direction to any other EMS service in the county should they choose to go with us. We have a strong working relationship with Richland Hospital, and we would be very willing to both provide mutual aid and accept mutual aid should we get to that point. Slide, please. So again, dedicated 911 ambulance, 24/7, 365. A dual purpose peak ambulance, that would be our transfer ambulance, that would be in and out. Historically, the last 3 years, it's been in base about 60% of the time. And then the interfacility ambulance, which would also qualify, that would be here 60% of the time. The dual purpose peak ambulance is the extra half time for 911. Again, moving from at the most AEMT to paramedic level. Next slide, please. So again, EMD, medical direction, and community ed piece. Carla, if you want to touch just on that.
Yeah, I mean, we have a very involved medical director, multiple services with us. We go out into the community, provide CPR. first responder. I'm in charge of a team of 4 other folks that do community education and do our internal education and quality review within Gunderson Ambulance, Tri-State Ambulance, and then all of our first responder partners and our basic ambulance services, a couple of them that we support.
Next slide, please. We would look for a January 1st go live. That would be the goal. Next slide, please. Our bid is $215,000. Again, considering this is, we are a nonprofit, this is enough to make margin, but really no more. And we are open to various payment models. Next slide, please. And that is our contact information. Questions?
We'll take questions after all the presentations, but I do want to say I acknowledge the fact that you said you started off a bit defensive, and I apologize for that. We are, just to remind folks, we are in a civil arena. We should be respectful of all people at all times. So we, just to be clear, we welcome your proposal. And we will authentically take a look at it and talk with you about it.
Thank you.
Thank you.
And then our last presentation is from Lightstar, and Michael Kruger is here.
I have a little bit more low tech handout for people to have. If you can pass those down, take one of each. Thank you for having me tonight. I'm Mike Krieger. I'm from Lightstar Ambulance. We are based in West Bend. It's a company that my wife and I started back in 1995. And back in 1995, we started with 1 ambulance and just a handful of people. And over the years, we've grown to expand our footprint in southern Wisconsin. And moving more away from the interfacility and more into providing contract services for municipalities, much like those here in Richland County. And I think that's one of our strengths, where each of the providers that are in here and the providers that propose have some definite strengths. And I think we all probably have some weaknesses too. But what you are doing here in Richland County is much like the areas that we serve in other parts of the state. They're rural communities. They're not a Madison, they're not a Milwaukee. We typically serve communities that have a population of somewhere between 5,000 and 15,000 people. And what I like about the model is those municipalities get together and they form typically an IGA in their governmental agreement and a governing board, and they're really our boss. We work for them. And although they don't generally get into the nitty gritty and the daily operations with that, they tell us, you know, what they want. If they want an orange and black ambulance, you know, like we consider that. At the beginning of this year, we partnered with some municipalities in Winnebago County and formed Southern Winnebago EMS. You know, if, you know, we're not tied to the Lifestar name, you know, like we're not trying to have a huge, you know, a huge kingdom, so to speak. And so if you have something that's more local and you want that to operate on its own, we can do that. And I think that's one of the advantages of us being who we are, is that we have a ton of flexibility and we really allow for the governance of the service that we provide without having to get into the weeds and really consume amount of time. So in one sense, you know, there's that oversight and that'll take a little bit of time. Sometimes we meet monthly, oftentimes it's quarterly amongst municipal groups. But, you know, like there's that little bit of oversight and guidance, and then all that extra daily stuff, the sick calls and the ambulance maintenance and ordering supplies and all that stuff is not something that any of the municipalities need to worry about. We're also very, very fiscally responsible, and although we're not the lowest proposal on here, it's what we feel we can do the service for and do it reliably. You know, I'm not a taxpayer here in Richland County. I'm not gonna misrepresent that, but we do treat the money of the areas that we we serve, almost like I'm the taxpayer there and that I have to pay that out of my pocket. We try to keep those costs down. You're not gonna see us buy $350,000 ambulances. Like Barb said, you know, like we can get good ambulances for $250,000 and provide great service out of that because it's really the people we employ that make the biggest amount of difference we have. I know that you need to move forward, you know, like the clock is ticking for 2027, but I do encourage you to talk to places like Adams County and Columbus Area EMS Group and Southern Winnebago EMS. And although the term, you know, private ambulance got dropped here, I think you'll find that that term doesn't, maybe sometimes has a bad connotation, but it doesn't need to have. And that those places that we serve will tell you otherwise, that us as a private company, we meet our response time guidelines. We've been great partners to them, some as far back as 2001, and that our reputation really could speak for itself with you. And I'd be happy to get any of your municipalities that information, those references if you'd like. You know, likewise, if this moves forward, you know, you'll see me. I'm not an absentee owner. I'm at work nearly every day. And, you know, whether it's now or in the future, you know, 5 years from now, you'd see me not every month necessarily, but, you know, like I'll be your face along with a local person, a local service director that would run the daily operations here. You know, we look forward to the questions you have for us.
Thank you.
Thank you.
And next we'll move to our staff analysis.
Anna, you want to take over? Sure.
Mind if I share my screen instead? That made it any better to read or not? Okay, so we did is we just kind of put everything that we got in terms of the proposals, we put it together, sort of in a summary, and I'll explain the different pieces of it. You have in your packet too, if it's easier to read in there. So we put, the first thing is the duration, service level that you're getting, so the number of ambulances, their replacement schedule, EMT, all of the stuff that they were having to offer side by side, so we could take a look at it in terms of what's being offered as well as the cost associated with those. So you're determining the value associated with each dollar that you're getting. Then again, the best way it seems to always look at this is equalized value. So everything that we've looked at was in terms of equalized value. So I just stated that there, this is the 2025 equalized value because the 2026 is not available yet. As mentioned, let me freeze my top here so we see what's better. Scroll down, you can still see what's going on. Okay, so as Gunnar mentioned, theirs was at 215,000 a year. Lifestar was at 404,000. Ryan Brothers didn't present tonight, but they were at 952,000, 907,000 base with a 45,000 one-time payment here so that they could purchase ALS patient care equipment. So they had a one-time purchase for that. Then the proposed is from the EMS service here. 500,000 was what I could decipher from the notes. And the only reason these aren't broke down in terms of, these are only like year 1 to year 5, because there is a cost of living adjustment associated with these. We just didn't have that exact number within, we couldn't pull it out of the proposals we were given. So whether or not that would be 5%, 10%, 100%, who knows? But let's think about it this way, you know, with Gunderson, even if it was 100% you'd be talking about 430,000 base, and then Lifestar, you'd be talking about 808,000 if it was 100% increase, you know, year over year. So you kind of see where I'm going with this. It's probably not realistic that they're gonna double your cost, you know, in terms of a cost of living adjustment. Would we see something on these? Yeah, more than likely, because within now, these colored ones are the scenarios I presented to you just to get people's creative juices going as to what could this possibly look like, you know, in terms of the biggest one being if we did buy 2 brand new ambulances, and we put in there a marker of 500,000 each, could be less, sounds like it could be less, but we put that in there. And the reason being is that we wanted a good starting point where we knew right out the gate that we are starting with the best equipment we can to give us the best option for success in the plan that we were putting forth. The other thing that this plan does that we built into each one of these is the 5-year replacement schedule. So not only buying the 2 brand new ones, but also having the funds every year to put aside to buy 2 brand new ones in 5 years, or buy another new one and lease one, or lease another 2, depending on if you were going to do scenario 1, 2, or 3. Just again, to get your ideas flowing about what you could possibly do with this and what it would possibly look like in terms of tax levy. Not picking one or another, any favorites here, but just saying, looking at it on paper for comparison's sake.
And I think it's important to know with the levying outside the levy limit, if we went numbers under, if we underestimated instead of overestimated, it's our general fund that would have to fill those holes. So we really want to make sure if we're going to continue with our service, that it's not our general fund making us whole in the end, that we're creating budgets that are going to be workable, livable, and that in the end isn't going to have to get 100,000 out of the general fund to make us whole.
Or fall back on municipalities to get more from you if for some reason we didn't have enough because we underestimated. So we did want to make sure that we included anything possible. You know, we're going to try our best to be good stewards of the money and pick, you know, obviously according to our bidding processes that we have, which is in our procurement guidelines, to make sure that we are choosing the best option for the taxpayers. Okay. So you can all kind of read through that. Now I'll talk about these lines at the bottom here. So obviously I added just to break it apart. So the proposed cost is what I call the base cost. And the reason you see these 322,000 over here is this is what we're short. If we just look at our normal day-to-day operations of top line revenue and expenses, we continue to fall short in the ambulance service by about $300,000 or so dollars. A lot of that does relate to our write-offs that we have to do in terms of Medicare and Medicaid. They come right off the top. Now, in looking at these proposals, obviously I don't get finite details with everybody's proposal, but it should be information that if known is included in your proposal. So I got the new ambulance. So the first one again, 2 new ambulances. This one here is buy 1, brand new one, rent 1. And then the last one you see that kind of stays static every single year would be, hey, we just leased 2 of these and we continue to renew that lease every 5 years and get 2 kind of newer refurbished ones. Okay. The next line is what we call the reimbursement for the current services. So to make all things equal, we basically said that if we were going to levy across all municipalities, then we have to take what municipalities are currently paying that are not in our service and reimburse that for that. So that would be their part of the tax levy that we're going to be levying against the whole county. So it would basically cover what you guys are paying. It would give it back to you and say, here's your money to cover your services in Muscadet, Lone Rock, you know, all the different ones that are covering their own. Then what we said is part of this levy that we need to do for the emergency medical system is that we can include 50% of our dispatch, or a third of our dispatch charges, and a third of our radio tower as well,
cost. And so what we did here is we worked together and we came up with what those amounts were gonna be. So right now, the radio tower, I believe, is coming in at about $250,000 a year for the total cost of operating that radio tower. And then the rest would be the third of the dispatch charges. So you take a third of the 250, and then the remainder of that 500 would be our dispatch charges, a third of those. And then we come down to what the total tax levy would be for each one of these if we went with them. So that's how we kind of made all things equal. Then we did, any questions on that page while I'm still here? So just kind of just putting it all side by side in a neat format for you. All right, then what I did is said, okay, let's look at what this does in terms of levy. And the same information that's on the front page is up at the top of this page. And again, what it's doing is it's coming up with that mill rate for you based on that total amount that we feel we're going to levy for each one of these. And you can see, yes, obviously the highest cost one is going to be the one where we buy 2 brand new ambulances, right? So, you know, again, maybe we're looking at scenario 2 or scenario 3 in our instances if we go one of those routes. So just breaking it down for you in terms of cost, and then in terms of what the various municipalities would pay. So I got everybody's equalized value over here, their percent of the equalized value. I even have the current costs that are being paid by the municipalities that are currently in the Richland County EMS contract. And then I also put in the population of each one of these. I did break it down by population per capita, not showing here, just because again, I'm not sure how that would be levied exactly on a per person basis. But at least in this case, you've got what it will cost your municipality for each one of these scenarios. And then down below, I gave you a chart of what it would cost based on some of these home values under each one of these plans.
So the reason we asked him to do that was to get all the numbers out, so we knew what we were working with. So thought on process, is if supervisors have any questions for staff on this, the time would be now to ask us, then we'll move to proposals once this is off the table. We just wanted to paint that broad picture.
Yeah, so you have all this information. If there's not any questions, then I'll turn it back over to you.
Please, Mr. Chair. You talked about the municipalities that are not being serviced by Richland County EMS, and then you talked about tax levy. And then at the end, you would give that money back to those municipalities, correct?
The amount that you are currently paying.
Right.
Yes. If there was anything above and beyond that, then we would, you know, figure out as the county how best to utilize that in terms of strengthening the service across the county, is my understanding.
So the municipalities, if they give you more than what they need, or what you need, then they would not get any of that back?
I think we haven't fully worked that out yet. So I today sent an email to all the municipalities scheduling that first meeting where we can get together with all of them and start talking about them. Leanna and I have a meeting with James Small, I believe tomorrow, to start talking about how are the different ways that we can set this up. Trying to be as fair and equitable as possible. So we're just starting those conversations. This is just really a rough draft of one way that it could look.
Well, my concern is you raise the tax levy throughout the entire county, and then my municipality doesn't take part in a Westford Township CAS. And then, you know, we get the taxes in, and the taxes are given to the county, but in the end, if it's above and beyond, our municipality does not see that money back. It goes to the entire county. So the way I'm reading it, correct me if I'm wrong, is that the municipalities are paying for services countywide for all municipalities in Richland. Is that correct?
The original motion was passed outside the tax levy for a fair and equitable process. The definition of fair and equitable wasn't that clear. But what the ideas were there would be rebates, it would go back, some money would be returned. But none of that has been set in stone. So it's all been, because the timeline we were under, we had to make a decision. So that's why the term fair and equitable is in there. But again, those terms haven't been defined. But given this county board, I think fair and equitable would be some type of return.
The other question I have is, like when you do property taxes and you say fair and equitable, I don't think it's going to be, because you're not gonna tax someone, like say in my township, and I'll use me as an example, 4 houses down, the poor guy can hardly afford to have food on his table. So he's not gonna pay the taxes that I am for my house, because my house is probably 20 years newer than his. So I don't look at that as fair and equitable either, because I'm gonna be taxed more than the gentleman down the road, and I don't want him taxed anymore. But I don't know how you're gonna do that, because it's not gonna be fair. It is not gonna be fair.
I guess if we were looking just at the 150,000, for example, you know, under these proposals, the most that person would pay would be $141 increase annually to their property tax bill. And then if your house, say, was over or at $1 billion, you would pay $938. Maybe not fair and equitable in terms of you're both paying the same amount, but you are technically paying the same mill rate. It's just based on the value of your property being worth so much more than that other person property.
And I think that's why when Leanna came up with the different scenarios for the county run, trying to make it the least amount of hurt on taxpayers. And so I think that's where when she lays this all out, she's showing each service and how much it's going to cost the taxpayers. And I think that is something that should be thought about, is how do we have the least amount of impact on our taxpayers?
And the value you get for that service too. So again, that top section of what's the value of the service that you're getting, you know?
Shall we move to the discussion of the quality of the service? The proposal.
I just have
Please.
a question. Just kind of sparked my interest on the, right now we're doing $250,000 for the radio tower, where some of this is used for the radio tower. What part of the budget is the radio tower being paid for right now? Is that coming out?
It's out of the operational
The
budget.
operation, what, that would free that up to go elsewhere, basically. Or.
It would, yes,
that's-
to account for
Working numbers.
insurance increases, salary increases, inflation, yes.
Supervisor Thorough.
I didn't catch what scenario 3 was. Is that all leasing?
That would be all leasing, just lease 2 new ones, or 2 refurbished is what they are, the ones.
Supervisor Welty.
Would it be possible to either make a note or adjust the column headings where it reads current scenario 1, current scenario 2, 3, so it's more descriptive? Otherwise, I need a sheet to refer back to what those refer to.
Any other questions for our staff? And then we move to the review of the proposals.
One more question.
Fair enough. Supervisor Frere.
Thank you. So in the spreadsheet, the first spreadsheet that you have, you could roll that. Oh, I'm sorry, we're gonna. You're adding $1 million, then 250,000 and 500 for the ambulances for the proposed service. The other interested parties, Gunderson and Lifestar, aren't adding new ambulances. They've already figured that into their expenses. So should we be figuring that in here? Shouldn't we also be considering that whoever is going to do this service would calculate that into their expenses as is? Why are we calculating that into the expenses when we're not doing that for the others? I'm confused. Why wouldn't we do that?
I guess my thought is because we actually have to pay for those ambulances, where we don't have to pay for the ambulances for their services.
But the proposed service should calculate that into their service
And have.
anyway?
So I think in their bids, and you guys can correct me if I'm wrong, in your bids, you've built in the ambulance replacements. Like, it's not anything that's gonna come back to the county where you need a new ambulance and you're gonna say, we need 300,000 for a new ambulance.
Correct, it's turnkey.
Okay. And then the proposed service, we are calculating the extra money that we have to break down for that.
So that's where, I guess that's one of the questions I have with Barb and the
Right.
proposed service is kind of how that works out. I think she had budgeted 350,000, maybe 350,000 for a new ambulance in there, but I'm a little confused by that.
Okay,
So that's
great
where we're
question.
hoping to have questions for her on that.
Okay, thank you.
Any other questions for us, Beth? Hearing none, we'll review the proposals. How would you like to do? Or questions you may have for anyone?
Well, the only thing I would say is we have policies in place, right, for when we do RFPs and everything we do. So at highway, when they come and when we order new trucks, we look at the bids and that's how we make our decisions. Now, mind you, this is a little bit different than buying a new truck, but there's a policy in place and typically we stay within the realms of being financially responsible for the taxpayer. So if I have a X truck for $300,000 and Y truck for $600,000, and they both bid on the same spec, I make a decision on that, right? Or we make a decision. This gets a little bit muddier than that, right? Because the truck don't start, we grab the other truck that does start and we go. So, I mean, you can't look at it as 100% financially, but we still have to be responsible. And the second part of that is when you look at them spreadsheets and you start looking at the townships that aren't in this service, some of them are gonna pay an awful lot of tax dollars to this service, where their service doesn't cost that much. It's a volunteer service that takes care of it. And Buena Vista is the one I'm talking about because it isn't part of my district. They're 200 million or whatever that was in the equalized value, and their service costs about $16,000. I've been on this county board for 8 years. We've been talking about the ambulance for 8 years. I was on the ambulance committee before I was on the county board through Eagle and through when there was a service or when there was a JAC. We've done a lot of work was done. But the thing that I don't think a lot of people realize is it went from a totally volunteer service, basically a full-time service. And that is a cost that no one was prepared to accept, probably more than anything. Because when we originally started with full-time, we had the ability to take more full-time on and we didn't. We tried to manage that budget and to not take any more money from the taxpayer. I struggle with the cost. And it's hard. I've got constituents that say you gotta do this, you gotta save this. And then you got other constituents that say, well, how can we just keep paying these? You just keep raising our taxes. You just keep raising our taxes, raising our taxes, raising our taxes. And unfortunately, in this time, okay, so we're in a time now where gas prices went back over $4. What's going to happen to the tax roll we currently have? We can raise the taxes, but if people don't pay their taxes, where's the money going to come from then? And that could happen in any of these scenarios. That could happen either way. But that is a reality. I mean, in all honesty, we need to talk to the treasurer and see what is deficient right now. And then in July, you're going to see another deficiency. So you got an equalized value out there that you may or may not get all the money that comes from that. There's a percentage of that every year we don't get. Now, in this state of the economy, is that gonna be worse? Most likely it is. So it's just another reason to look at it. We gotta decide what we're willing to bite off and support going forward. It may not be the lowest cost, I get that. But this is not gonna get easier. And I just think we just need to be really responsible with that. That's all I can say. There's a lot of emotion that goes into it. I get all of that. But we still gotta be fiscally responsible too. That's part of our job.
Thank you, well said. There are supervisors that have been thinking about this for quite a while. I am looking forward to their statements. Please. What do you think?
Can I ask a question? Like Mark said, you have these townships here that aren't even, that are doing their own with, volunteer service and stuff. My question is, I'll use my example again, Westford and Cass. They have been able to maintain their own for a very, very long time. And they're still maintaining their own. And what I don't understand is how can that little municipality maintain their own with the area they cover, because they cover part of Sauk County as well, and still continue, but yet Richland Township and Richland Center cannot. What is it, and even Viola and Buena Vista, what is it at Lone Rock? What is it that they're doing to be able to maintain, but yet Richland Township and Richland Center cannot?
I'd like to get the supervisors'
I
views
just could
on
answer
this.
that question.
But I'd like to get the supervisors' views on, please. We'll come to that. Steve?
In addition to the financial side, I hear what you're saying, but I also hear that some of the bordering service areas, it's getting to be hard to get enough volunteers. And so whichever path we choose now, we need to think about which one would be most capable of potentially expanding and catching those areas if they need the help. I don't know which path is better for that, but that needs to be part of what we think about.
I guess I look at it as always look into the future. What are the possibilities of the future? I like the idea of keeping all options open, looking towards the future, looking at the possibility of the option of even doing the joint fire and ambulance service together, which would eventually cut down costs in different areas of the ambulance. Just looking at how messy some of the other options can be with, I'm thinking of like with dispatch and organizing, coordinating, all of that with new ambulances. The messiness that could be, I look at with the proposed service that we have now, looking at that as even cutting down on arrival times and things like that. Those are people from the county, they know the roads, they know where they're going. They're not gonna have to always rely on GPS or be taken astray by GPS on different calls. Just kind of throwing just different aspects of different services out there. They've already got the relationships with the outlying areas, working with them, how they work with them, things like that. The one ambulance service had said that they would consider going with those other areas if it came to it, but it's a definite, it's gonna come to it. So we've already got that in act. So that's my proposal.
I don't mind being pushy. So other supervisors, please. Shirley?
This is probably most contact I've had from constituents. And I've had maybe a dozen contacts. Don't raise my taxes and don't let anything happen to the ambulance. I mean, that's what it boils down to. I also, I don't like to badmouth anyone or any service or any, but for 1 year or more, the scanner in our living room on the end table there was receiving Vernon County dispatch for emergency medical service. We were constantly hearing from the city of Rockland, all LaFarge, all Kickapoo, all Reedstown. Because Tri-State, or whatever it's called now, has no one available, no service available. Now switch to last Palm Sunday. My wife and I were at the anticipatory mass Saturday evening in St. Mary's when she had a medical emergency. Turned out it wasn't that serious. It was a low blood pressure issue, but it looked pretty serious at the time. And we were fortunate that there were 2 nurses at that service that helped us immediately. And the chief of police was there and he called for the ambulance. And they came right away. I mean, right away. And then I went out to my car to go up to meet her at the emergency room. And I got there before she did. Because they didn't just put her in the truck and haul her behind up there to the emergency room. They treated her first. They gave her the treatment she needed, got her there safely, and she stayed overnight, but the next day things were fine again. And I don't know how we do away with any service that's that good.
Supervisor Welch, thank you. And Mr. Supervisor Schoonover and Severson were coming for you.
All right. When I think about our ambulance service, it is such a critical component to our community that is staffed by such special people that do this line of work. It's not for everyone, and I am so grateful we have people who are willing to make this their profession. The decision that we make is not a one-year decision. It's a multi-year, has a multi-year impact, because if we were to choose to use a third party, there really is no going back to staffing our own and providing our own ambulance service here in Richland County. I think it's also a critical decision that for the entire county, not just the entities that are currently using the Richland ambulance service. And it's because they travel into Richland Center or in this vicinity that's served by the Richland ambulance service. So whether you reside outside of it or not, you still come into Richland Center and still use the services that are provided here. It's also where the courthouse is, it's where the highways pass through, it's where Pine Valley is. So there's a lot of factors that drive up the number of calls and the expense that's associated with staffing it here. But it's probably one of the more difficult decisions that we'll ever have, that I'll be a party to here. And it's not a one-year decision. It's a forever kind of decision. And it's expensive. And it's expensive for a reason. It's because the criticality of the care that's provided and the equipment that is needed is expensive. It's also expensive in year 1 or 2 because as a county board, past decisions were made to not fund it and to redirect those funds elsewhere. So it's an opportunity to correct that situation if we have the stomach to have taxes like this. It's expensive and it's a big decision.
Yeah, so my thoughts on there, I agree about having to be good stewards of money. I also was touched by Rachel's comments last time about the growing poverty level in the county in the elderly. So once we get other opinions on the table, one of the questions I want to ask the providers is, which one has the most likelihood of being able to respond to multiple calls consistently, quickly? In other words, what the response time is. To go back to Rod's question about hearing calls from other, who can respond to those needs the quickest? So you two, you can pass.
No, I'll stop. I've been to now, let's back up. We have one county board meeting a month. I mean, I'm at 12 now. That is until last month. And we were meeting about every other day there for a while. And at every finance meeting and county board meeting, we always have public opinions. And I appreciate everybody that has come and talked to us about the ambulance situation. I needed more information than what I was getting in this room. So I actually created a survey in the people of my district. At the census, there's 791 people in my district, 790 plus me. And I shot for 10% of the people that I interviewed. And I made that mark because I wanted to know how everybody felt about this issue. Before I started my survey, I had to come up with some rules that I needed to follow. The first one was to be absolutely neutral. When I sat down and started talking with people, this was just one neighbor talking to another neighbor, one person to a friend to another friend or family member. They did not know what happened. They never did know because we talked about everything. We didn't talk just about the ambulance issue. We talked about everything else that we're facing. Because I wanted to get this person-to-person talk going. I didn't want to try and steer them in any direction one way or the other. Last thing we talked about was the ambulance issue. I laid down the facts the best I could. Out of the 10% or 79 people that I interviewed, there was no one that wanted the third party provider. They wanted to stay with the current people we have. They have a personal and positive relationship with our technicians. And not only did they say, okay, I want the present form. They said, I want our people and I do not want the third party. Then we got to the cost price. Most of my interviews were done before the RPOs ever came back, so they didn't know, I didn't know how much the third-party candidates was going to cost. So I told them, I said, preliminary use is going to be $1 million a year to keep our ambulance service intact. They looked at me, every single person told me, we want spending limited across the board. except for our ambulance service. They said, you need to do what you need to do to keep our ambulance service the way it is. That's what I thought.
Supervisor Severson? Anything? And then Supervisor Frank and Supervisor Miller. Pardon?
I don't, I don't feel good about knowing we're exceeding, going outside of our levy limit to fund for EMS, knowing that there's a potential that a third party could provide EMS in our county. And we subsidize that with our tax levy dollars. We subsidize their operation. And they in turn are able to bill the consumer. Third party would be able to provide a service subsidized through the county levy dollars from our citizens and able to bill the consumer on top of that. If I had a business and I was running it, that is the business that I would want, because my overhead now has went from trying to actually make it to I don't have to worry. I can set the cost of whatever it is, because now I'm going to monetize a location, be able to provide that service, and nobody's going to be able to compete.
Supervisor Frank or Miller?
Well,
You're welcome.
yeah, I would like to say something. My group is up there in the Viola area. I think our biggest concern is the future. If Richland Center dissolves and we have maybe 2 or 3 people running the ambulances out in there, which I think is kind of coming because we're getting older out there and not the people aren't showing up that are interested in doing all this volunteer stuff anymore. But one of the representatives I have said, I don't want Richland Center. I am in Viola and I'm never going to use them. And I thought, well, now that's kind of an odd thing, because who knows when they're going to use them. But anyway, I think our group out there they're happy with being Viola and Yuba's first responders. They're happy with that staying as it is. And I know that they're concerned about the money, what it's going to cost, but it's on a human basis. You know, what kind of a price can we put on saving someone if they're 45 minutes away from Viroqua and Viroqua's already having trouble getting people moved around? What would Richland Center have? And that's where we're at now.
Supervisor Frank or Carol?
I guess a question I had for Gunderson actually was, they have a very low bid, and lowest bid anyway. And I tried to study the 990 forms. I tried to understand the complex Gunderson nonprofits, how they all, I couldn't figure it out. But it just seems like you can't do for that little of money, is what my lay person's impression is. So I just wondered if you could explain how you can be that.
We will get to that question after all supervisors.
Okay.
And staff have said something, because I have that question about arrival time too.
So my thoughts through this, the outside, the edge communities that supply EMS services, the Lone Rocks, the Cats, the Violas. If we've already proposed to do the tax levy, I guess I'm curious, are they going to get more money from the tax levy than they'll be putting into the tax levy? I don't know what their population is. I don't know what their dollar figure is, but there's a possibility that they would end up getting more money than what they were contributing into the pot. We know what their bill is, but we don't know what their equalized value is of their area to see what that difference is. I'd be curious at some point to see what they're doing. And where are they getting the funds to run their services now? I appreciate bake sales. I appreciate all those things. I appreciate how they get the funding. Is this just a way to move the funding from where it's coming from now to another format that they're then aren't going to be spending that money in that other area? I don't know that, but those are questions I want to dig into. EMD. I'm a huge proponent of EMD. Actually, I set up the grant funding, the PSAP grant funding. I'm the chair of the state 911 subcommittee that sets that up. And one of the rules was, if you provide EMD to your service area, you will get grant funding. If you don't get grant funding. Now, Gunderson was very correct. It could be either personal, done by the PSAP, or it could be contracted out. Either way is fine. We have, I think, 1 or 2 counties in the state right now that are not accepting the grant funding because they don't want to do EMD. I mean, that's silly. That's not my county. That's the way they're choosing to handle it. So EMD is near and dear to me. It's very important how they get that. I have my opinions on, I think one way is a little better than the other. Locally, I like that, but I have talked with companies, agencies, Vernon County and some of the dispatch there. I talked with a lot of the PSAPs in the state. Their contracted services are excellent. They're freeing up the dispatcher's time. So the EMD remotely or secondhand is not a bad thing. That happens a lot in the state. Okay. Funding will still continue for the PSAP here. That's not a concern. I guess the bottom line is the county's not in the business of ambulance. We're going to be in the business because we choose to be. That's not our business. In the end, it really isn't. If we choose to go one way or the other, that's something we have to look at. But I would really like these proposals to be, whether it's Gunderson or Lifestar or the proposed service, they should be their entities that take care of and manage it. Is the county going to tax it and take care of the billing or take care of the tax part of it and then help disperse those funds? That's fine. But I think at some point we need to get out of the ambulance service as a county. That's not our job. We should fund it. We can do that. We can support it. We can make it better. We can do what we can. But the actual management of it, I'm very concerned, is really not our direct responsibility. And I'll leave it there for now. Thank you.
Thank you for everybody coming out. Turn to the county administrator for some words.
Just a couple of things that I want to make note of, and anybody who's a service director in this room, if I'm incorrect, DHS has requirements for ambulance services. There are certain things that you have to follow, that you're required to follow, and if you don't, the state's going to step in and say, hey, you're in trouble, like we had back in 2014. So as much as we hear on social media about the challenges of other services, when you go and get the facts, they're not as bad as what social media portrays. And I'll give the example of Tri-State and Baroquays, 3.2% of their calls since 2022 that they need mutual aid. We have to think about the huge number of calls they're having and the small percentage. It may seem like a lot, but when you look at the percentage, it's 3.2% of their calls. I believe in Sparta, it's 4% of their calls. So it's not this ginormous amount of calls that they're not taking. It is a small percentage of their calls, and our service requests mutual aid sometimes. Every service at some point in time may need to request mutual aid. So we have to remember that. So when we're out there saying our service can do this, but others can't, all services have the same requirements, and DHS has the same iron hand that they come down on you if you are not following through with your requirements. I'm a little concerned about, we're going to prioritize a non-mandatory service, and we're going to let our required and our mandatory services deal with the cuts. That does worry me a little bit when people say, just don't touch our service, make other cuts. We sometimes can't make other cuts. We have things that we are required to do. The last thing I want to say is if we are going to keep our service, it's really important that we set it up to be successful. And I think that's what Leanne is trying to do by putting together a budget that builds in yearly increases to costs, a budget that gets us ambulances that are good, that are trustworthy. If we are going to keep it, I strongly encourage us that we go with one of Leanna's proposals because that sets us up for long-term success.
So to state the obvious, we are not going to have a consensus on this. We have different opinions in the room. So before we get to the recommendation, which I have some ideas on, that I'll share, maybe we can ask those questions directly to the providers. So I think there's 2 on the table and there could be more. But I guess the first one is for the providers. We hear about long waits for ambulances, right? And delays in people coming. So I guess my question is, how do we deal with that? Who would have a good record of response time? How would you talk about that?
How do you want them to answer each individually, or you're asking all three the same question?
Yeah, all 3 the same question.
How do you want them to respond?
However they want. They can choose to pass too.
There are reports you can run off of the state EMS system that will tell you what your response time for every call is. It's provided to everyone equally off your CAD system.
So there's no difference between the 3?
No, I'm not saying that. I'm saying any of us could get you the report, and we'd be happy to do that. I have it at the tip of my fingers. Our out the door time to those calls is typically under 2 minutes.
Yeah, if there's a difference, that's what I'm trying to foster. If it costs more to have stronger service, I think we should do it. But if it's the same, then it's a different ballgame.
I think the biggest difference would be if the agency was running on call or volunteer, because you have to wait for people to get dressed and respond from home sometimes in the middle of the winter when that slows you down. So knowing that, you know, they're staffed, and Gunderson and us would propose that too, or have proposed that as well, like response times would be pretty similar, I believe. And I don't think any of us want to race to a call going 90 miles an hour. You know, so although we can exceed the speed limit with lights and siren, you know, we all have to be prudent in the same ways.
Please.
Yeah, I would just note as well that, you know, one of the requests on RFP is for paramedic level ambulances. Lifestar, and we do provide that now. I kind of touched on it earlier, but the challenge with paramedic level ambulance services, the paramedics are not effective. They're very difficult to find. So although there may not be tremendous challenges now, moving up to the advanced life support level and having DHS and regulation require you to have your first out always paramedic, puts a different dynamic in it as well. To the response times and to the activation times, we do have metrics that we track for tone, the time of the tone to en route. Those are things we track, and we'd be happy to report out.
Supervisor Caro, your question. Restate it.
Well, you're talking about my earlier question. Yeah, I just, again, I was trying to understand your financial situation where you're able to offer the service at that cost. And is there some way that Gunderson is structured that you're able to subsidize that, or I'm just trying to understand how you can get to that number.
Sure. I guess a few things. Number one, overhead, spreading our overhead amongst any given day. We have 15 to 16 ambulances staffed throughout our western Wisconsin region, Iowa, a little bit southeastern Minnesota. So we have coverage area there. So that overhead is spread across all of those service lines, all of those districts, if you will. For example, Wall, this ambulance service, he oversees 80 to 90 employees now. So there's one manager where we segregate or have individual communities, they all need their own. Pretty much that's a DHS, not a requirement, but service director basically requirement. The second piece is, I would say if this were 2 years ago or 3 years ago, and Mike knows this very well as well, well, there weren't the grants that there are now. So Wisconsin DHS has a FAB, which is a funding assistance program. That's grown tenfold in the last 3 to 4 years. Extremely helpful. And that's for 911 ambulance services. I assume the county's taking advantage of it. So that's helpful. The second piece is, as a private nonprofit, we're eligible for the Medicaid assessment program. That is taking federal match dollars, a complicated program, I won't even try to explain it myself, but essentially taking federal match dollars and bringing those back into the system. Hospitals do it, healthcare does it. That's helped us out quite a bit in the last 2 years. So that's something we're a little worried now with regulation that it could change, but for the next foreseeable future, we're seeing. So that's helped. Secondly, we model this county. We have services in Prairie du Chien, Wisconsin. We have, as you all know, Brokewood. It's a different company, but that rolls up through me as well. So we know what a 911 call revenue is, and we know what our costs are. We have many, many years and decades of experience knowing what our costs are. We don't build in a big profit. 3% just to ensure we can buy new equipment, we can buy ambulances, a little bit of.
Any other questions?
I just wanted to call grants and since Tom hit on it. The innovation grant has been dangled in front of every municipality that we serve. And although that would be a great treat, I don't feel that this county or this board should, although it wasn't discussed here tonight, look at that as a guarantee by any means. That would be the icing on the cake. So if that gets discussed at some point, I mean, that's by no means guaranteed. But any of us, could technically, whether it was any of our 3 providers, still have the county be eligible for that if the parameters are met.
Any other questions? So regarding a recommendation, right? This is just a thought. This is probably one of the biggest decisions we're gonna make this year, right? We have a lot of different people on different sides. So my thought would be to advance 2 of the providers to the county board with a vote so that people know where at least 9 supervisors are on the proposal. And then at the county board meeting, do this again.
I would, me personally, I think all 3 of them should go to full county board. This is way too big a decision for a small group to make. It just doesn't make sense. We have to, the whole county board needs to see everything that we just said. Because it affects, there's parts of the county board that definitely don't have, their constituents may not be interested in that, All at the end of the day, I want us to find the best possible service and fortunately at the least cost, right? And that's the goal. I don't know what that is. Because I got people in my township that are on both sides of it. One, they're 100% this way and one are 100% the other way. And you'll have one group say that, why wouldn't you use a third party? And the next group is why would you? But to me, as Orion Township, you're all third parties. And that's the way I have to look at it. Because I'm the town chairman Orion. So they're all third parties to me. I just have to, the difference is the county's gonna put up the money for it now. Otherwise, I had to put up the money for it, or the township had to put up the money. So I mean, number of things that you gotta look at, each township is in a different place. And the townships need to be represented also. I mean, Brian's here just because I know Brian, but everybody, all the townships, the JAC have served a purpose in the beginning very well when we were all there. And that's disbanded to some degree because they didn't want to be involved in service. And then it stayed at the group that basically is affected by this today. And my hope always was that we would create a district and it would be like the other districts I'm involved in. And the district, we provide the money and the district takes care of the service, right? As a township, that's what I'm required to do and that's what I want to do. And I want not to have to worry about it. I provide the money, they provide the service. So that's the same thing I'm setting in here today with. The difference is now the county's gonna provide the money. Now we gotta find out what's the best.
So we have 3 possibilities. Take a vote on 1, move 2 forward, or move 3 forward. Other ideas, or what's your pleasure?
believe we should move all three forward. Let everyone
Also, they're gonna.
see.
We have a motion to move all three forward with a second from Mark Cooley. Motion made by Sandy Kramer. Any discussion?
I have a question. Can we get clarification when you say move all three forward? Do you have a specific county one that you want to move forward?
Well, it's our county, Lifestar and Henderson.
So are we talking like the proposal that Barb put forth or the information that Leanna has put forth?
Can we do both?
So then there would be 4. And if it's Barb's, I think we need to, and I don't know if now is the time, but I have questions on Barb's because we have a lower operational budget than what we're at right now. And she's adding a staff member, so I think we need to really get clarification on where those cost cutting is going to be. I think her proposal, and again, this would be a question we need to ask, looks like it's expanding the service area of, no, not expanding the service area? Okay, all right, and that was
I'd like
misunderstanding.
to have that
on that.
resolved before the county board meeting, whatever that is.
So with the budget?
Yeah, so if you all could meet and decide that, and maybe come with one. So we're looking at 3 rather than 4 or 5. This is getting further and further complicated. So it's a big decision. So the more we narrow the table, the better off we're going to be, I think. So if it's if it's 3, let's take 3. And ask that proposal to work out whatever that is. Come with 1. So, well, sure, Shirley?
As another component to work out is the timing of ambulance purchases. That was a pretty big difference too, between purchasing 2 right off the bat and 2 aren't needed, whatever that might be. To help lower what that initial year 1 cost.
And I would argue that if we really are going to set us up for success, we need to get 2 right off the bat.
And that may be the
From
case.
my understanding, the 3 we have are not good. And if we only purchase 1 and that one breaks down, we don't have any.
And that may be the case.
Yeah.
It's to resolve that difference.
Okay.
Also too, if we're putting this off a little bit, we'll have time to get, the reports from all of them for response time.
So then we're really not comparing apples to apples. Because we're gonna be adding $1 million or some number to add 2 new ambulances that the other services are already providing in their numbers. That, I guess all of a sudden, now we're not apples to apples. Now we're providing 2 ambulances and we're saying they have to provide their own. And so these budget numbers really are kind of proposals that become kind of skewed to me. I guess my question is, in a proposed service, Barb, you did not include any ambulance costs to replace the ambulances? This was entirely going to be on the county's back?
That's not, I mean. I'm
Well,
not
that's my
saying-
question.
Right, I'm not saying that. The money is in my proposal.
Okay,
What we differ on is the amount of money to be spent.
okay.
So we have a proposal on the floor to move 3 proposals forward to the county board.
Please name the 3.
Second. Lifeline,
Lifestar.
lifeguard,
Lifestar.
Lifestar, excuse me. How long have we been?
Yeah.
Name the 3, please.
Lifestar, Gunderson, and the county system, county service.
Thank you.
Any further discussion?
Good idea. So to that point, if we did just take these out, you wanted to take out the brand new ambulances, it's as simple as we could do that.
Right.
Then you know right now that you have a $322,000 hole that still needs to be filled from a tax levy, which is putting us at $1 million in the tax levy, that either way, for any of these proposals that you would look at, including the proposed service which the only thing I noted when I was going through the proposal was that it was missing a big chunk, which was called the Medicare, Medicaid write-offs. Direct write-offs were not included in the proposed service. So.
So again, what we're asking is
Pretty large
these
hole.
issues be resolved and brought to one law. So we have a motion on the floor to move 3 to the county board.
Question of the three again, are Gunderson, Lifestar, and when you said county service, is that the proposed service or?
Here's the proposal. Post service.
The proposed service?
Well, the proposed service modified with us getting together. Or are you just wanting Barb's as is, as part of the proposal?
I don't think we want any question about 4 different models. I think we want one that can compete with these other 2 and see what we have. So what will it take to have Barb and the county get together and come up with one?
I mean, we can
Or
certainly.
you can advise Barb on what to do. How
Right.
about that?
Or vice versa, but yeah.
But these 4 different ones plus the 2 further complicates the field. And we need to simplify the field in order to make a good decision about how to use our tax dollars to take care of people. So let's not muddy the waters anymore.
Those, yeah.
That would mean that the director of ambulance should be included on some of the financial meetings that are happening.
Oh. And, I did actually send our director of ambulance service, budget to complete for me a forecast template that is laid out in the way that I've always laid out my templates so that I could easily compare apples to oranges and see if there was anything different. What I got back was basically my forecast with 2 changes for the year and nothing filled in for 2027 through 2031.
Because
Even though I gave you a template.
Right, I just need. the
So point of
answers.
order, this is not the place to do that. You can do it off the floor.
But yes.
Do you realize that county is not responsible for emergency care? It is the townships. The county should have never tried
Understood.
taking it over.
Understood.
And you guys need to understand that. And if you do the tax levy right, you know what districts it has the Kickapoo, Lone Rock, Muscadet, Boone River. You know what pieces of property that they service for us here in Richland County. Give their share that you collect from that district back to their ambulance service. We don't need to bring in another ambulance service. Because I can tell you 2 stories about waiting for an ambulance to come with people with a heart attack. One was my husband, one was my daughter, and the other one was one of our former EMTs.
So folks, see if we can reconvene and address the motions on the floor, which is to move 3 forward to the county board.
And there's no cost you can put on it on life.
Without a vote at this point, right?
Right.
So you don't want to see where people are at this point to guide our discussion. All right. That's the motion. All in favor, signify by saying aye.
Aye.
All opposed?
Aye.
So 8-1. Fair enough. That, we move on to revised item number 9, possible action, discussion and possible action on camera on in county vehicles.
Sorry about that. So this is a conversation that we started at the last meeting. And at the last meeting, it was proposed to go to full county board. And at full county board, they did approve having the cameras in all the highway department vehicles. There was not a decision made on the other vehicles throughout the county, primarily because there were some concerns regarding HIPAA. We did get answers from our legal counsel, who has said having a camera on the vehicle is not a HIPAA violation. Where it could come into play is what you do with those recordings. And so I'm coming back to the committee to say, do you support having cameras in the remaining county vehicles starting for the 2027 budget? So there are 12 other vehicles. HHS has 3, Pine Valley has 3, ambulance has 3, maintenance has 2, and land conservation and zoning has 1. It was just getting permission to build cameras into the 2027 budget.
Supervisor Frick.
I like the idea of cameras. I want to know what the budget is and how it's going to affect for 2027 as we're going through what our budget is going to look like. I don't know if we can make it, put it somewhere on the priority list, but down a little bit, because there's going to be some things I think we just have to be really conscious of. And that might or might not make the cut. I'd like to see what those numbers are. I think we should move forward in that direction if that helps.
Nice to know the department director's recommendations too.
I'd also like to know the cost of managing the records requests that we would anticipate to receive. I think that that could be a sizable expense, and the larger the files are, or numerous they are, by adding more vehicles, I think it could increase the expense associated with managing them.
And who's going to do it?
Yeah.
And I think the 2 biggest departments that are going to have those requests are already approved to have that. I mean, it's going to be highway, it's going to be our sheriff's department. These other entities, I don't see that it'll be on a large basis that people are going to be making those requests.
Would it be possible to see that data, how that was determined?
The number of cameras or no, the number of vehicles?
What we expect the expense to be and how it would be managed, because we've talked about opinions, but it'd be nice to see the data.
Supervisor Frank.
And I guess who would then be responsible to do the release of those videos or whatever? And we know that highway department, sheriff does their own. With that, who's going to be the person? Is it,
Typically the clerk's office.
Okay, yeah. Too many fingers in the pot trying to pull data.
Yeah.
So your pleasure on this one is to hold it? Postpone or move?
I thought, I was under the impression we wanted to go forward, but it's gonna be a line item on the budget, and we don't have any money, we'll probably cut it. That was my understanding. If that's your motion, I'll second that motion.
I will make that motion to move it forward. Gather the data, though, however, it might be cut as part of the 2027 budget review.
So we'll leave the cut out of the motion. Just say, we're gonna move to add cameras on in county vehicles to the budget line item. Research.
Yes.
Seconded by Cooey. Discussion.
Question that I want to be involved with the data gathering is who's going to be reviewing these cameras? How much is going to be involved with that? If it has to go to a third party, how much is that going to cost?
So if we have to review the cameras, it will only be if there's a call of concern. So if somebody calls and says, I had an issue with the land and zoning vehicle, can you please check on that? We'll review those. And the company that we are working with, and you probably can answer this better than me, they will be the ones to get us that data that we need.
It's truly really simple. So like, let's start from the basics. Like right now, if I have somebody call and say, you hit my mailbox, you hit my vehicle. It takes me more time to run down that employee, interview the employee, and then try to find witnesses to verify that than it would be to use the system. Because we actually did demo the system. We tried it. So when a concern came in, which actually happened, it took us all about 10 minutes to go pull that video camera footage, and it was downloaded right to the department head's computer. Nobody else had access to it. And I could share with it with the administrator whom I deem fit, which would be part of the policy of how it goes from there. So as far as like the data storage, well, that would just be saved to like the instant file or something, but we are not housing any of that information here unless it's something as part of the vehicle accident, which is the same as having paperwork, accident reports, so on and so forth. So it's actually more of an efficient thing than it is to not have.
So it's been moved and seconded to have a line item budget prepared on cameras in county vehicles and further research. All in favor, signify by saying aye.
Aye.
Any opposed? Motion passes. Discussion and possible action presentation of the 2027 capital improvement plan, agenda item number 10.
That's it. Don't watch me.
Share my screen again here. Just give you the summary, similar to what I went over the last time. There's just one change. Oh, that was a lot bigger. Hopefully that helps. Okay, so this is the summary here, 2027 to 2029, but what we're really talking about is the funding for 2027. Includes 1.5 million for highway, 230,000 for MIS, and 260,000 for sheriff. So the sheriff's one is the one that changed. I had over here on this page, I don't know if you can see it very well. Open up a little bit more. So there was 20,000 here for metal detector for the jail/court. That was, I had it accidentally in 2028, so we moved that over to 2027. So that's why the sheriff's cost changed from the last time that I presented this to you. So this just gives you a breakdown of where the money is being spent. So for MIS, 150,000 for Dell EMC replacement, 80,000 for additional hosts. And they had some money from 2026 that they're gonna add to this as well in terms of completing their projects. And highway equipment, we've got 500,000 for equipment, a new truck, and then $1 million for various road projects, which 1 or 2 roads, I believe, not the entire thing. And that gets us to 1.99 million for our short-term borrowing for 2027.
What's your pleasure?
Just curious, what did we borrow last?
Right about $1 million.
About $1 million, yeah.
We've almost doubled that. So we're doubling that, which this is about $80 per 100,000 per million. If I remember right. So now we're at $160 on everybody's taxes for this. Just to keep everything in perspective. Now, anybody that's been on board very long, seen this, you should not be surprised in any way, shape, or form, because it's been projected out for the last 10 years. But we still got to keep this in mind when we talk about all these things we're going to do. So, right there's another $160 per 100,000.
And I think some of that, when I looked at it and I looked at highway comparison year over year, is that technically from the regular tax levy, that 1.6 million has been cut from highway in the last year. So then we got to make it up somewhere because trucks still need replacing, you still need to complete road projects and.
It's not a complaint, it is the reality that we knew was coming.
Okay.
It's just coming to fruition because there's no ARPA funds anymore covering all our other stuff that we were fortunate enough to have. Now it's coming and we knew this was gonna happen. But that's why I focus so much on, it's important to be financially responsible or fiscal responsible, whatever you want to call it. Because we got a tax base that does not grow and we have more need every year. Every year, and our tax base does not grow.
It's your pleasure, our presentation of the 2027 capital improvement plan.
It's inevitable. I mean, I'll make the motion, because the motion needs to be made.
That's the motion to move it forward to the county board.
Yeah.
I would second that.
Any further discussion? All in favor signify by saying aye.
Aye.
Any opposed? Moving on to item number 11, approve of the merger of the CCS-CCOP committee.
Hi, good evening, everyone. This is Stephanie Ronfeld. Can you hear me?
Yes.
Yeah, Stephanie.
Okay, great. So some of our programs, part of the requirement for some of our programs is that we have various advisory committees that have to be put together. In the past, CCS, our Comprehensive Community Services Program, was a standalone committee. And then our Coordinated Services team and our CCOP program, Community Options Program, were in its separate committee. What happened in 2026 during the budget process was we no longer applied for the grant for the Coordinated Services team program. So that kind of left the CCOP committee kind of hanging out there without a place to hang out. So what we are proposing is that we merge the Comprehensive Community Services Committee merge the CCOP Advisory Committee with the Comprehensive Community Services Committee and make that one committee. So we're asking for permission to do that merger and then move it forward to county board along with all the approvals for who will be appointed to the committee, because that also changes as well depending on the statutory language on who needs to be on it. So that's pretty much it in a nutshell. There's no financial impact to this. It's just a merger of committees.
That's good. It's weird. Thank you for that.
Enough acronyms for you there?
Just didn't equal any more money. That's the only thing.
Oh, yeah, you're welcome. You're welcome.
Sandy is chair of that committee.
Excuse me?
I said Sandy is chair of that committee. Do you have the motion?
I'll make that motion to join the two.
Second by Supervisor Welton to approve the merger of the CCS-CCOP committee. Any further discussion? All in favor?
Aye.
Any opposed? Motion passes. Item number 12, discussion of possible action, future presentations by department heads.
So this is an item that Tiffany had requested be on the agenda.
There was actually somebody that had listened in on our last meeting with that and has reached out to me. I have not talked to them yet. I can forward it on. But just like what she just did with her presentation of merging this through, with our packets that we have, the little, 2-minute blurb or whatever, can go into our packets. It relieves people from being here when we talked about moving meeting times and things like that, trying to keep things within workspace. For people, they can do little videos on it. They can, if we have questions, ask questions ahead of time. This makes you do your homework ahead of time, and then if you have questions, submit your questions. They can answer your questions. They can be online to answer questions. They don't necessarily have to be here. With the school district, we've moved to this and it has cut our meeting times down from 2 to 3 hours to where we can get through a 24-point agenda or whatever in an hour because of these videos that are submitted. We don't have to have all of the principals at every single meeting. We don't have to have everyone at every single meeting because stuff is done ahead of time, which it does streamline the process. It makes it very efficient and it's a nice feature. It'd be nice to see that happen here with just because of the talk of moving meeting times and trying to keep people in their work time and not having to send them to a meeting every single time. It would be nice to have that option. There is, like I said, there is somebody that emailed me that does the technical part of things where they could get with the technical team and discuss all that and see if it is an option for it.
Reducing meeting times would be nice.
But it has tremendously moved things, streamlined things, made things more efficient, and it's a very nice feature.
I'm all for streamlining and making things more efficient. I'm a little concerned about filling about the ability of our community to have access to being able to view those videos where they do have an option to come here and sit with us and observe that way. I just want to make sure that we don't get disconnected from the people that we're here to represent.
Interesting to hear what the department heads say. Josh?
As long as it's an option that's available in the toolbox to use, okay. I would say that we already have to be at the meetings when you step up to department head level. It's kind of expected, you need to be at those meetings, and if you have something coming forward, we already do agenda item coverage, we take the time to fill in the administrator or fill in our actual committee that they could fill in if we can't be there. But like the biggest fear is if it's something big enough that needs to go in front of the committee to talk about, we would like to be there in person regardless to answer the questions, because if we go forward and do a video presentation and then some question comes out of left field, well, then we can't answer it. And then it has to come back around, and then you're just extending your meeting time out because now it's coming back on the agenda. So as an option, sure, but I wouldn't make it like the mandatory thing that we take the time to do.
No, and with the school district, the way we do it, a lot of Sherry Johnson, she's great. She will give us the video ahead of time to prepare us, give us a lot of the input, but she's sitting there in the meeting for any questions and for to elaborate even on her video and stuff when it comes to big things, yeah.
And I brought this up at our department head meeting last week. They said they like the interaction with the board members. They like coming to the meetings, and they feel it would be easier for them to come give the presentation, answer the questions versus doing the video, getting the question and answers back and forth, because we have to be careful of the walking forum. So if there's a question that you have, 5 of you could all have that same question. They can only answer it back and forth with one. And so we do need to be careful with that. And so I think they all agree with Josh. It's nice to have it as a tool in their toolbox if they can't make it, or if there's something else there, but they would prefer to come and be able to speak.
So do we need a motion or something so we can add this to their toolbox, or do we not?
That's what I was thinking. Yeah, just something real simple.
Just
That the
give them
department heads be
opportunity to
invited,
video.
be allowed to use, be permitted to use video presentations when applicable.
We need to describe when applicable is, so because some of your department heads can use that video all the time.
It sound like these folks.
No, but
Which ones?
I personally like people showing up in person at this point.
Well, if no consensus, maybe we'll just let this sit.
Yeah, the only thing I would say is they need to have the opportunity for whatever reason something happened. But not to be used on a regular basis is how it should be worded, you know what I mean? Maybe it's prior approval, I don't know what it is, but an option to do that, but not a regular.
School district have a policy on?
A lot of times they will put their video in, they will sort of show up. And if we have questions, we submit our questions. We don't submit it to them personally, so for the walking forum thing, we don't submit our questions to them. Our questions will go to the administrator or the district administrator or the chair is who our questions go to. And then they will ask their questions and then come back with a response in the meeting. Will be the questions. This is just a thing, for instance, if one of them is going to be on vacation or something, during the meeting time, they have a very important presentation. They can put forth a video for us to watch ahead of time. We can still ask questions. They can be online to ask questions if they can't be here. If meeting times get moved, and just for their convenience.
Craft your motion as a tool for adoption. What do you have? Craft your motion as a tool for adoption. What do you have?
I would make the motion for the opportunity to do this if they so choose, if they can't be here for their convenience.
So the motion is that the department heads be provided an opportunity to use video when appropriate.
I'll second the motion with the comment that it also leads to creativity sometimes, and it can be a pretty entertaining little video. And you can work on it.
It's been moved and seconded that the tool be provided. Really?
Mr. Chair, who are you recognizing as the first for that motion?
That was Tiffany, seconded by Rob.
My concern is with the timeliness of the information. There's been information that's been added to our packets at a last minute over the last several meetings that I haven't had the opportunity to review in advance. I discourage that. I think that's a real problem for us. And we would need to have a hard and firm deadline that is met so that it can be reviewed ahead of time. So we don't have that ability at our most recent meetings.
So we'll put it on future time.
And if I'm not mistaken, there is a policy that we are to have our stuff and our packets are downloaded that Thursday or Friday prior to the week of our.
Supervisor Frank?
What's prevents them from doing it now? I mean, at this point, they could right now if they chose to, right? We need a separate action if we know they could do it right now if they wanted to.
It's just highlights it for they can do it. Motion to use video as a tool. All in favor, signify by saying aye.
Aye.
All opposed? Carries. Discussion and possible action, resolution designating the county highway commissioner to serve as backup county administrator as needed.
So this is a request that I'm having, so on times that I cannot be at work, just to have somebody available to the staff if something comes up that's an emergency. They wouldn't be dealing with all the day-to-day tasks if it can wait, but it is just if there's an emergency in place, they can reach out to Commissioner Elder and say, hey, this is where we're at, this is what's going on. It's going to be pretty rare that we would need this, but we do need to have somebody available on those times that I'm not.
I would move that to the county board.
Second?
We gotta get it on the floor.
Sorry.
Well, I will
Second.
second it.
Second, motion by Frank, second by Tiffany. Thoughts?
Sandy. Seconded by Sandy.
Oh, Sandy. Thought it was Tiffany.
Now you get it.
No.
Josh, you're okay with this? Yeah, I've done it before. It's, again, we're not saying that as soon as she steps out of the office, I'm gonna come in and run the whole show. This is just to keep status quo going.
Well, I really appreciate that.
Yeah.
I do have one question. Say Josh leaves for greener pastures. Would that be part of the job description for his replacement?
It would not, just as we rescinded at the last meeting that being the county clerk, we would then relook at who it's going to be. It wouldn't just automatically go to that person.
I recall the discussion from the previous meeting when the county clerk was established for them. And there was discussion about compensation. And it was determined that the county clerk wasn't appropriate because it was an elected position. This is an appointed position. And so as we continue to add responsibilities to the county highway commissioner, I think we should need to give consideration to what duration, what extent, and when would compensation apply.
I'm gonna restate what I said before too, because when you look at the future, I just feel like if you're constantly rescinding ordinances, it gets sloppy, it gets messy, it doesn't look good. When you look to the future of Richland County, this board isn't always gonna be this board, it's not always gonna be us. The administrator isn't always gonna be the administrator, okay? The highway commissioner isn't always gonna be the highway commissioner. I think we can't look at the person, we need to look at a position, that anybody that comes into that position is well qualified to be able to be the backup for the administrator, so we can set a policy, have it be set, and it's not something that rescinded because, oh, well, this person left, or oh, now this person left, and now this person left. Not going on the person, but going on the position. Looking at different positions that would be qualified, no matter who was in that position. Looking at the HR director, looking at the finance director, doing a joint thing maybe between the two of them. Looking at a position, not the person, because the person's going to change. So looking for the future and what's benefiting for the county, I feel we need to look at the position, not the person.
So I put on for another future agenda item policy for administrator backup.
And then defining the job ability of that person when they're in that role.
Any other discussion?
The only thing I would say to that is, no matter how it changes, so if you say the clerk is always the backup, and the clerk changes every 3 years, that probably doesn't work, right? Now, if you were in a different form of government, the clerk would be that position, so that would change that. But it doesn't matter what position you talk about, Tiffany, every one of them, the person can change, and the next person most likely is not gonna be capable to run the county in a short term.
That's why I'm saying we look at a position where that person comes in is well qualified.
But my point is, the only way you're gonna do that is if you create a deputy clerk, or deputy administrator position. And it's gonna be tough to do that with our budget. And in the short term, we gotta have somebody that if something happens to Trish on the way home, somebody's gotta be able to answer the question. Whatever that question may be, that, you know what I mean? Or if she's gone on vacation or whatever the case is. So I understand how it gets muddy every time, but unfortunately, until we can afford the position that is considered the backup, this is the way it's gonna be. I'm not against trying to get to that, but I don't think our budget supports it right now.
The other thing is we pulled this once, was before on the agenda, because we wanted to have a discussion with Trish about who she saw as leaders she could trust in the county, right? It's just because that personal connection has to be key. So we had that discussion and she's identified the leader she wants. So I think we honor that. Any other discussion? All in favor, signify by saying aye.
Aye.
All opposed? Hey.
Mr. Chair,
Yes,
was there any opposition?
it was one.
Was that?
Supervisor Thompson. Item number 14, discussion and possible action, Ash Creek parking lot repairs.
So the upper parking lot at Ash Creek had some pretty significant water damage with the heavy rains earlier this year. Our highway department went out, gave us a bid for $3,000 to fix it. We do not have any funds in the park budget to fix it, so we are asking that contingency funds be used to fix the parking.
Highway Department contingency fund?
Yeah.
So my only question is, are we gonna fix it and then fix it again next year, or are we gonna hopefully just fix it?
We're going for a pretty much permanent fix. We have a giant gully washer, but right now it's actually set so it collects all the water coming down the road into that parking lot with no drainage. Culvert in place, we're actually gonna add a culvert and then we're gonna redo some of the parking lot to help divert that water flow, so impact should be minimal in the future.
I would make a motion to pass this on to county.
Motion, second, by Shirley. All in favor of
Discussion.
for discussion?
I'd like to make a comment that I think it's really important that we use this money to fix it. Otherwise, we'll need money, be spending money to make it safe. And I think it makes sense to spend it to fix it.
Here.
All in favor of the motion, signify by saying aye.
Aye.
All opposed? Motion carries. Item number 15, discussion and possible action, review of county land assets. Just by word of these next two items. I want to go back to what Mark said about we have rising costs and stagnant funds coming in, right? So I think every once in a while, it's good to kind of step back from county, from the day to day, take a look at the big picture, and then take a look at what we need to have and what we don't need to have. Should we sell some things? Should we not? Do we need this? Do we need that? And then look at other revenue sources as well. So anything that comes up is not set in stone, or there's no agenda behind it, okay? I just want to kind of bring this up and open this up. But there's no agenda in any of it. It just, okay, we're going to be broke. What do we do? So, assets.
So I've headed to the package the two different attachments. The first is the footprint of the county. And you will see that we have Simons, we have the community services building, the courthouse and the jail. We have the ambulance building, we have Pine Valley Fairgrounds, the Tri-County Airport, and the highway out at Bowen Circle. There are a couple of other remote highway shops. I believe there's one in
Casanova, one in Goldtham, and we do have the sand pit as well, but that's still up in the air whether we get it.
And then I added an attachment with the county parks. So we have Ash Creek Community Park that is 354 acres. We have the Orion Boat Landing that can take 20 cars in a picnic area. The Pier Natural Bridge Park, which is 10 acres and has camping. Port Andrews Boat Landing has 20 cars in a picnic area. And then we have Viola County Park, which has 5 acres. We also have Akey School and then the Pine River Trail. So those are the building assets and the land assets that the county has that I'm.
Any thoughts, ideas?
Well, the only thing you gotta remember is, just like everything, once it's gone, it's gone, right? Now, in some cases, that might not be bad, but in other cases, it might be really bad. I mean, some are liabilities and some are
So
indirect,
again,
indirect revenues.
Yes, no, again, no agenda on this, right?
Exactly.
354 acres. It's going for 8 to 10,000 an acre now. Right? Or we reinvest, but
But put that in perspective, our CIP is 2 million. You got 2 years worth of CIP.
The way I view assets are that there's likely to be revenue that comes from assets, there's likely to be expenses that are associated with them. And if we're able to leverage assets to increase the revenue to offset those expenses, we should really consider what those things are. Do we have data to support what revenue do we see from our assets and what expenses are associated with them? I have no idea what it costs to maintain some of the facilities that we have, like the fairgrounds as an example, and what the revenue that we have are receiving from there. So if we have that data, that'd be very helpful.
is it possible to get that data? That'd be really helpful. Thank you. Anything else on this?
I know I'm gonna get crucified for this, but.
That's okay. I've been there.
Here we go. I am very naive about what I'm gonna ask. I do not have the answers. I just have questions. How does the average taxpaying citizen of Richland County benefit from owning Pine Valley Manor? I'm just asking. I don't know.
My understanding is that's another non-mandated service, right?
Lots of non-mandated services that we always do.
Yeah.
911 is not a mandated service. We do not have to have 911. We're gonna get rid of it? That's a requirement for counties to have.
There's an article in the Wisconsin State Journal that had, forget how many counties were selling their 6, 7, 12, something like that. I don't know what that was.
Oh, I was just wondering how salt came out on there. Had they sold it, had they stopped, or, you know, what?
This was a hot topic when I worked at Reedsburg, so I was kind of, it's been back and forth. They have actually moved to try and sell, and then at the last minute, they changed their minds. I really don't know right now what they're doing.
I don't think they've sold it.
I don't think they have either. Now, again, I'm naive on this. I'm not saying, hey, this is wrong. I just would like to know how we benefit from Pine Valley Manor.
Given our fiscal reality, we not talk about this stuff?
We have to.
I do.
We have to, yeah. So we can start with the assets with the revenue. And keep going with that. We just need to do it, but not all at the same time.
Yeah, there was an article recently that Dubuque County in Iowa sold their transferred ownership of their fairgrounds to a nonprofit organization.
That's,
As an example.
we've discussed that in the past. It's been brought up. I wouldn't say, but to how to make the fair better, right? And how to let it grow, because it's evident we're not really good at growing a fair. Whether it's just because we don't put effort into it or we don't put money into it, whatever the case may be. But it's been talked about in the past. Do you give that to, I don't know, what's Vernon County's? Is Vernon County's a?
Big society.
It's a society, right, or something?
Big society.
Yeah. But I mean, it's kind of, that's what it's a mindset, right? So unfortunately, I think the mindset is that we just own everything, right? We've just always owned everything. So why would you not own everything? Why would you not run everything? And at the end of the day, maybe it did work before, but then when I look at when I got on the board, we were deferring maintenance on everything, and it just, you know, we didn't borrow money before. We never borrowed any money until Clint came. I think Clint was the first time we borrowed any money for capital improvement, and that was to free up the operating budget because the other stuff wasn't getting done. We didn't have any squad cars. We didn't have anything. So that's why all that stuff started. And now you've seen what that's turned into, and it's not going to get less. And I'm not saying it isn't the right thing to do. All I'm saying is it's not going to get less. So all of these things are definitely going to be things we have to discuss. Unfortunately, we're discussing probably one of the hardest ones right now.
One at a time.
You know, and I think I agree. We just take them one at a time and just keep working through it. The problem is the budget comes every year at the same time. You got to react from budget year to budget year.
Can we agree that we'll start with Supervisor Welty's question on the revenues? We'll start there
And
next
expense.
time. Pardon?
Revenues and expense.
Yeah, revenues and expenses.
For the parks at the fairgrounds?
All the properties. Ash Creek, all the way
Wonder
down.
what tourism brings into this community.
It's hard, and that's a hard number to see revenue.
I know, but it comes in, and we get that sales tax too from that.
Exactly, and there's what, $1 million a year in sales tax, something like that?
And we're the only county that does not have a state park. Every county around us has a state park, public land that people can go and recreate. Where can you recreate here in Richland County? Out at Ash Creek Forest, where at? Down along the Wisconsin River. Got limited access to get to that public land, otherwise it's private ownership all along 60.
So am I thinking around that, when we look at the data, there may be opportunities for us to increase our revenue associated with them by changing some of our actions or behavior, or how we, you know, does Ash Creek, do we consider Ash Creek becoming a state park or something like that? There might be opportunities to drive behaviors to increase our revenue.
Becomes a mountain bike trails.
It's got all kinds of trails.
And then, you know, I just want to comment like on the fairgrounds, like you want to turn that over to a, let's say, a big society or not-for-profit. Well, if it's costing us money to maintain those buildings and run those buildings, what's it going to take for that nonprofit? It's $20,000 right now just for the electricity for that place. Once those lights get turned on, you have that demand charge. And that nonprofit organization has got to have that money every single year. That's not on top of actually operating the fair and maintaining those buildings. Where are we gonna get that? Where could they get that money to support having that fair? Or having a thing out there, other than trying to charge somebody for running the grounds out?
How do we do that? It's for different, we'll talk about it at a different time, because this is good. The fairgrounds has, in my opinion, has opportunity. We just gotta figure out how to get going. And I think your question is gonna show us that, hey, we need to do something. And I think we surely can. But it's not, we're gonna have to front load money on it because we don't have it right now.
So we agree this becomes an ongoing topic, one at a time, not too many. Okay. So that, anything more on item number 16. Hold on, 15. Number 16, discussion and possible action, review of new revenue sources. I think we just did that. Unless there's discussion on that, we can keep moving. Correspondence.
Mr. Chair, there was an objection to the letter in this correspondence item. Regarding
Any other correspondence? Future agenda items. That discussion we were just having, I had a discussion like that with Troy Mag from Southwest Planning. Troy is involved in every other county. And in the 5 minutes we had for the discussion, it's like all these new ideas start coming. So my thought would be, I invited Troy, if that's okay, to our next executive finance committee for the first 45 minutes to begin that, to continue that conversation we just started. Is that okay? So Troy will be here via Zoom that day, June 9th. Great. Any other items?
We will bring the draft 2027 budget guidance and objectives for you guys to review and finalize.
That's coming, okay?
Next meeting date.
I believe it's Monday, June 9th.
we also talked briefly earlier about the timing of the availability of that meeting materials.
Yes, on the future, another future agenda item is the deadline for the packets.
Yeah.
Yes. Yep.
June 9th, Tuesday.
Maybe it's the 8th.
Oh, it's the night.
So then,
Yep.
okay,
Tuesday, right?
Tuesday then.
Comment. 6 board members represent the city. City council meets 1 week from tonight. Be nice if we had representation here.
Can I just jump back to the timeliness of the packet? The goal had always been 48 hours in advance. We've kind of gotten a little behind when department heads don't get us the paperwork. We can go back to trying very, very hard, and I can make a big push that everything's in the packet 48 hours in advance and see how that goes if we're comfortable with doing that.
And I don't know that 48 hours is the magic window either. I just find it unfortunate that at 1 PM I can upload, review, go through everything, and I show up and there's important documents that are brand new to me. I feel at a disadvantage and that I'm not able to do my role justice, getting information complete.
So I will go back to pushing for the 48 hours. I felt for a while we were doing pretty good. We've gotten a little behind lately, so we will get back to trying to do 48 hours.
Any other future agenda items? Hearing none, item number 20, I'll take a motion to adjourn. Moved by Cooey, second by Welty. All in favor, signify by saying aye. Aye. Any opposed? Thank you all for your patience.
Anytime.
We love
You know, it's never any, first of all, don't get
Um,
mad. We're trying to get a little bit more focused now, so.